With the latest health news, Lauren Cohen joins us with the Fox Family and Health Report. Lauren.
Good morning, Dave. Good morning, Tamron. It's Breast Cancer Awareness Month, so our coverage continues this morning. Breast cancer is the second leading cause of cancer death in women. This year, it's estimated 182,000 women will get breast cancer, and almost 1/4 of those women are likely to die. Doctors stress the need for monthly self-examinations and annual mammograms. So, just how accurate are mammograms? And what if the patient has breast implants? To answer these questions, well-known Chicago plastic surgeon Dr. Roger Pielet joins us this morning. Thanks for being here.
Thank you.
We appreciate you coming in. Now, you see more and more women who want to have breast implants every day.
Yes, that's correct. The incidence of breast augmentation in 1992 was about, with the statistics from our professional society, about 32,000. Last year it was 167,000 people.
When these women come into your office, is there a concern if I get breast implants, will I be able to detect breast cancer, early lesions if I have a mammogram?
There is a concern, and I think that's a very important concern. I think what we have to do is just be honest with the patient and explain some of the risks. Nowadays, there are new techniques in mammography. The radiologists and the technicians have different techniques where they can move the implant in its position. Some of the implants that are used nowadays, particularly the saline implants, actually allow the X-ray to penetrate through the implant, and so much less is missed. The other advantage nowadays is that most of the saline implants are placed behind the muscle, which also further allows better screening.
All right, you mentioned X-rays. Let's take a look. We have some mammograms. One is of a clear mammogram.
Correct.
And this type of case, if there was a lesion, obviously without implants, it's easy to detect. Here we have the breast implants.
Yes.
Two different
You
visuals.
can see these are silicone breast implants. The image on the left shows the mammogram with the implant. The image on the right shows what's called the Eklund compression view, where the technician or the radiologist can actually displace or move the implant out of the way and pull the breast tissue forward to allow better visualization of the breast tissue.
Now, you brought in several implants. Which is silicone, which is saline?
This is the silicone gel implant.
Okay.
And these two are saline implants.
Now, most people today getting the saline?
Most people are getting the saline implants. The FDA has released reports stating that there is no known health risk or medical risk to the use of silicone. And in certain situations, if a patient qualifies for certain protocols, silicone gel is actually being manufactured and used.
So does it matter if it's saline or silicone when you're talking about mammograms?
I think it's, well, for primary cosmetic augmentation right now, we are not using silicone, but I believe that it's basically important to counsel the person and explain. If the person has a high family risk, you want to do what is going to allow the best screening.
And finally, just one more question for you this morning. What about the size of the breast tissue? If you have a less amount of breast tissue, less likely to develop breast cancer?
Well, there is a statistical significance that the more breast tissue there are, given that the family risk and so on is the same, the greater the chances of developing breast tissue. And statistically, individuals with less breast tissue are often the ones that opt to have cosmetic augmentation.
All right, very interesting. Dr. Roger Pielet, thank you for joining us this morning. We
Thank you.
appreciate it. Tamron and Dave, back to you. Thank you.